just having fun with this. Thank you so much for joining once again, Jean.
Yeah. Thanks, everybody. We are recording this training via Zoom. And as you can see, I have the closed captioning on so that as I'm talking, there will be words on the screen for folks unable to hear volume or if you're listening in somewhere where you can't have the volume turned up. So I want to start with a greetings and welcome to Understanding PASSR with Telogen. Again, this is going to be a brief introduction. So I want to start with our agenda for today and the purpose of this brief introduction. We believe it is important to relationship building to share and connect names and faces to the extent virtually possible, that is. We're going to cover a bit about the company of Telogen for those of you who are unfamiliar with us as an organization. Then we're also going to look at the Telogen PASSR philosophy and what makes us unique. After that, we'll provide an introduction to our web-based portal Qualitrack. Then we will cover next steps for training and go live. And like I said, we're going to finish with some time for Q&A. So we want you to bring all your good questions so that we know what's on your mind. I'm going to start, first of all, with a who's who and what are their roles in supporting this transition. In terms of our virtual meet and greet, I'll start with the Telogen team and myself. My name is Jean McClurkin, and I am an LCSW in 3 states, Colorado, Iowa, and Montana, as well as holding my licensed addiction counselor in Colorado. My role and how I will be supporting this transition is by being the main contact for clinical implementation. I've been the one leading the Telogen PASSR effort in Montana since 2019, and I am thrilled to be returning to Colorado. I have a long personal history in the state as a licensed behavioral health provider, working for 10 years at Arapahoe House and in the Denver Metro community behavioral health settings, as well as spending some time at Denver Health Inpatient Psych. Pam Valvano, our next Telogen employee, is the lead for this entire contract that Telogen has with the state of Colorado HICPUF. PASSR is just one aspect of that larger work. She has been supporting Colorado healthcare initiatives for several years as she was involved in the Colorado Foundation for Medical Care before it merged with Telogen back in 2014. And in addition to her passion for healthcare, Pam is skilled at IT systems. She loves a good Excel spreadsheet. Stephanie Wilson, the other member of the Telogen team, is our Qualitrack implementation manager, and she has over 19 years of experience in IT systems and implementation of new or transitioning systems. She is one of our lead Qualitrack trainers, and we are lucky to have her. She lives in Iowa on an amazing ranch, and her daughter is an accomplished rodeo equestrian. It's very cool. Now, in addition to these 3 named individuals working at Telogen, we are currently hiring and onboarding staff that will be dedicated to the Colorado PASSR contract as reviewers of the level 1 screens, schedulers for the level 2 evaluation, level 2 evaluators. We will also be partnering and contracting with a range of local professionals to support timely in-person assessments. But we believe in providing a dedicated and consistent team that we can build these successful and deep relationships with all stakeholders. We want you to know who we are. We want you to know our names, our faces, and how you can reach us for questions. All of our personal emails are up on this slide, and please feel free to email us during this time of transition and ask us any of your questions. We want to be involved with you. And next up, Telogen is partnering and being supported by individuals at the state. We've been having extensive communication and shared meetings for the past few months to prepare for this transition. And frankly, they have been a huge joy to work with. Very lucky. They share our person-centered vision for PASSR, so we're on the same page. Obi is the lead PASSR administrator at the state in the healthcare policy and finance. He is our main point of contact for providing oversight on this contract. He's been involved in PASSR initiatives for the past 4 years, and he's also well known for being a very dedicated and involved dad. Next up is Michelle Voss. She is the Notice of Determination signatory for the Office of Behavioral Health. That serves as the state's mental health authority. She is well known for her love of Palisade peaches, which we all do, let's be honest, and enjoying time down in Pagosa Springs and baking tasty treats for her coworkers. Tricia Stone is the Notice of Determination signatory for the Office of Community Living, which is serving as the state's Intellectual Disability Authority. In addition to PASRR, she's also the Home Community-Based Services Waiting List and Enrollment Specialist. She is well known for her love of animals. Now, on to all of you who are attending this training. There are 4 main stakeholder groups that have unique needs and unique challenges. There are hospitals that serve as the nursing home referrals and complete level 1 screens. There's the single entry point and community center board personnel that complete level 1 screens. And then there's all of you. There's nursing home supports that both complete level 1 screens and implement the level 2 recommendations. And last, but certainly not least, there are the individuals and their collaterals that are the true focus of the PASRR work. Telogen as a company believes in being accessible and supportive to all stakeholders, as those of you that are familiar with Telogen in our other spaces can attest to. We seek to have open communication and to seek out active engagement through the entire PASRR process, including post-level 2 follow-up. The goal here is not to add any burden to your already full plates, but rather to assist and support you. Now for a little bit more about Telogen as a company. For those of you who may be unfamiliar with us, we were first founded in 1972, and we are now 100% employee owned. This means that we have been around in healthcare improvement field for over 4 decades. And the fact that we are also employee owned is important, as it allows us to stay connected to our mission, which is to transform lives and economies by improving health outcomes. Our employee owners are committed to finding innovative solutions to make a difference, an actual difference in the lives of people and in the world of healthcare. Telogen as a company began as a quality improvement organization, or a QIO, which we remain to this day. We work in Colorado, Iowa, Illinois, and these roots in striving for continuous quality improvement and member-focused care, those filter out through every other diverse contract that we have, including PASRR. So we are a national company, but our headquarters is in West Des Moines, Iowa. We have offices in Des Moines, Baltimore, Denver, right in the tech center, Boston, Chicago, Oklahoma City, Boise, and Richmond. We are currently providing population health management services and IT solutions too to over 10 million Medicaid, Medicare, and commercial members. We have over 650 employee owners that stratify into 2 main halves of our whole. Half, we have clinicians working as assessors, reviewers, case managers, physicians, nurses, social workers, pharmacists, and folks specializing in behavioral health coaching. And we have technical folks on our other half that work as statisticians, biostatisticians, business analysts, health information technicians, system developers, and reporting analysts. Having this dual focus on both the clinical and the technical, connected in a mission-driven employee ownership, gives us an edge, makes us a great team. I also wanted to share a few things specific to what makes Telogen unique when it comes to supporting PASRR process, as this is just as important for all of you as is knowing who we are. So first, Telogen views the PASRR process as a primary clinical opportunity, rather than pushing paper for compliance with a federal requirement. Secondly, we believe that timeliness, quality, and utility matter. We believe a system that balances useful and relevant assessments with efficient and user-friendly technology is what is needed here. We want to add value for all stakeholders. Third, though we may be new, relatively new to PASRR, but not to healthcare improvement or clinical assessment, this makes us nimble. It makes us open to learning so we can adapt to help improve our processes at every turn. We are not married to processes we've been doing for the past 20 years. We can be flexible and learn and leverage new evidence-based practices as they emerge through PTAC, and even looking at the notice of proposed rulemaking that came out in 2020. An important aspect of our philosophy is also that we are holistic and person-centered in our approach across all of our books of business. This makes us a great fit for PASRR. And finally, we provide good and accurate data on outcomes and follow-up to help drive for meaningful change. We are looking forward to partnering with the state around reporting and data collection so we can help assist in tracking trends as close to real time as possible so that the data remains actionable. With that summary of Telogen as a company, who we are, and our PASRR philosophy, I'm going to turn it over to Stephanie Wilson, who's going to share a little bit about the Qualitrack system. So Stephanie, I'm going to turn it over to you. You're up.
Hi, everyone. Thanks, Jean. So I'm going to kick it off by talking a little bit about our Qualitrack provider portal, which hopefully all of you will get the chance to use. In the late 1990s, Telogen created its own proprietary system that we called Qualitrack. As we've moved from that time until now, we've had some major upgrades and enhancements, and we're currently on our third version of that software package. Our goal throughout that time has continued to make it efficient and effective for all of you who are using it. So as we build out that software, we've really tried to make it a true population health system. So we're able to do utilization management, care management in that system, and then combine that data and output that through reporting, analytics, and quality metrics to make sure we're constantly improving that work we do to make it more efficient and effective for all of us who are involved in the process, including all of you. So part of those updates include some step-by-step instructions. So as you submit a review through our system or go back in to check on that review, it's very step-by-step, user-friendly, efficiency-driven, all of that's available there. We built in automation to help streamline that review process and that review flow. So from the time that you guys submit it to our reviewers review it, every step of that is built into the system so that those reviews are directed to the correct people, and those notifications in real time are sent out so that you know continually the status of that review or if we need additional information or things like that. We also here at Telogen are very concerned about security. We try to stay ahead of and with any industry standards that are out there so that we make sure that all that PHI and any PII that gets uploaded or is part of that review process in our system is maintained securely so that you don't have to worry about or stress about what information you put in there and how that gets used. Because of the fact that our Qualitrack system is a web-based online system, you can access that anywhere that you have an internet connection. So you can continually check to track the progress of any submitted reviews. Again, see if there's any additional information that's needed or if a decision has been made and you now need that authorization information. That's always available for you to access in the portal using that 24/7 availability through the web. And finally, we continually make advancements to try to make it as user-friendly and as effective and efficient as possible. We always welcome feedback on that as you get into the system and start using it, but that's really our goal, to make it effective and easy for you so there isn't a burden to submitting that information through the system. Next slide. Yes. So a little bit, and we'll talk about this, Jean will talk more about the upcoming trainings and things like that, and we'll go into the provider portal registration and kind of walk through all of the steps in our next training. But we just wanted to give you guys a heads up and provide you some information. So the way our system works is that everyone will have to have an account to access our system. And we work or look at this as an organization. So if you're a hospital, a nursing facility, care management agency, whatever, that office or that group of you is considered an organization, and each organization will need to have one or more what we call an authorized official. So that authorized official will kind of control all the users that have access into the portal within your organization. So again, if it's a hospital, you may have one or more authorized officials. You do have to have a minimum of one, but you can have more than that if that's what works for you. And then those authorized officials will add additional users, maybe remove users to have access to the portal if they've changed positions or maybe left the organization. So you get the ability to manage your users so that you are always aware of who has access to that data and you can keep that process secure. So the way this works is we will have a link posted on the Colorado website, and we would need a manager, an executive, someone in a leadership position to start that process. And they'll follow the link and follow the directions, and then they'll say who they want their authorized official or officials to be. From there, the authorized official will receive an email notification letting them know that they've been registered to be the authorized official for that organization. They'll finish completing that online process, fill out all the data, the information that's needed. And then once that information all comes back to Telogen, we will go through the process of setting up those authorized official accounts. Again, all of this is done online, so you don't have to go have anything verified or anything like that. You'll just go through those processes through email information. It'll get routed back and forth, and it'll end up back at Telogen. That portal registration is currently listed at the link that's down here at the bottom of this slide. Again, we'll go through this in more detail at the next training, but you can go ahead and start filling out that packet if you would like to do that now. Just as a heads up, it does say on our packet that we should complete your registration process within 3 to 5 business days. Just know that now we won't start sending out any of those emails with your username and information on how to access the system until the last week of February. And the reason that we're doing that is when we send out that information based on the email address that you give us, the link to set up your account and activate it in Qualitrack is only good for 7 business days. And so we want to make sure that when we send out your username and that information, that you're able to go ahead and process it. So expect to start getting those the last week of March, but you can fill out and start that process as soon as it is convenient for you. And again, that information is all here in this link. Yep, thanks, Jean.
Yep. And those emails will come out the end of February, not the end of March. Just as a quick.
Oh, sorry. Absolutely. Yes.
Yeah, we're thinking about March because of go live, but emails will come out at the end of February. Okay. So next up, I wanted to talk about what our next steps are. We have, as Stephanie alluded to, we have 2 trainings coming up following this week's introduction. So next week on February 16th will be part 1 of our PASRR level 1 training, where, as Stephanie said, we're going to focus more on how to set up accounts in Qualitrack, how to get people created in the system, and then some basic navigation of our Qualitrack system. So all folks that are targeted to be that provider executive, that person who can sign the authority of your agency, down to the people that are going to be the authorized officials, those few folks that will be in charge of all accounts for your organization, those folks really should attend that training or at least get a copy of the slide deck. And again, for people that want to be kind of ahead of the curve or jump the gun a little bit, please know that that packet is out there for you and you can begin the process now. But also, like Stephanie said, nobody will actually get emails to get into the system with usernames until that last week in February, regardless of when you've started the process through the online DocuSign forms. Okay, wanted to mention that. And again, these slides will be published. You'll be able to see those links. You'll be able to see everything. Following that week will be our longest training. So today we're going to try to shoot for about that half an hour, 45 minutes, leaving time for questions. Next week will be about 45 to 60 minutes as we get into Qualitrack. Then the last training on February 23rd, these are all on Tuesdays. The last trainings on February 23rd will be the longest ones. So those will be a good hour. We're really going to deep dive into the PASRR program, into completing the level 1 form. We're going to demo the system, so you're going to see us walk through it. And then that recording will be available for you to have as a guide as you're moving forward. So that's where I think that having the trainings recordings will help. We are also going to be publishing physical handouts, PDF files, both of slide decks with screenshots and of little quick cheat guides. So depending on your learning style, if you're visual like me and you want to watch a video, you're going to be able to do that. If you really would just like the step-by-step written word, you're going to be able to do that too. And if you're more of a person who just likes the quick summary, you'll have that option. So hopefully we've hit all learning types there. Do it how you need to. All of this is in preparation for that March 1st go live, which is coincidentally my son's 3rd birthday. So I'm looking forward to that day for many reasons. I also want to know something that came up at the last training too. This go live of the Telogen portal on March 1st is not affecting the 1135 waiver, which is currently in effect and will be through the end of April. And we can cover that more in the Q&As if people have specific questions. I also noticed during the chat while Stephanie was talking that I do want to let folks know we did max out at 300 participants. So this Zoom line could only hold up to 300. So we will have recordings available. We will try to rework this for next week so that we don't have to have the limitation of only 300 people attending. I will ask that if folks have multiple employees at a single program, maybe find just 1 or 2 people to attend the training live and then be able to debrief that training with the rest of the folks at their organization. That might help us be able to allow everyone to participate from across the state of Colorado with the nursing facilities. There's over 250 of you all. So we want to make sure that everybody that wants to, some representation from each facility can attend in real time. All right, so thank you for letting me present those basic introductory slides to give you all a taste of who we are and how we come into this work. Put names to faces and let you know that we are real people. And now I really want to take some time to hear your questions to be able to answer them to the best of our ability. We have all 3 of us from Telogen here. We have the 3 folks from the state here. We can answer questions. If your question is about something that we're going to cover on one of the upcoming trainings, I may let you know that we'll have more information on that in the weeks to come. But I do really want to turn it over to y'all. If you want to use the chat feature, I think since we do have the 300 participants, everyone going off mute at once might be a little chaotic. So I will ask for folks to do the chat, and I'm going to share the chat screen over to the side so that we can see that as well. Okay, so let me go back to the first questions that are in here. Can folks see the chat? I moved it over to the screen I'm sharing. Okay, yes, thank you, Sheila. All right, so can you tell us where to find the packet again? So the packet is on, let me bring back up that website. Here is where the packet is. So link to portal registration right here, colorado.gov Pacific HCPF long-term services and supports training. That is where the registration packet is to build your Qualitrack account, as well as a little PowerPoint on the slides and the steps for the authorized individual, authorized officials. Again, we will go over that in depth next week, but if you want to get a head start, please feel free. We publish this for you guys to have. Next questions. And I know there were people that joined kind of as we move in, so I want to make sure I get that. So Kara or Kara, that was your question. Next one, is this going to replace EQ? Yes, we are the vendor. So Telogen is the vendor for the PASRR work that will be going effective March 1st. I'm not sure, Obi, is there anything else you wanted to say about the transition? I'll open it to you if you want to cover that too.
Yeah, sure. Thanks, Jean. So is this going to replace? Yes, this is the Telogen is going to be our new vendor for multiple programs within OCL, but we are very specific to PASRR with this training that we're doing right now. I may have missed this in the beginning, but can you please share why? Yeah, the main reason, there are several reasons, but one of the, I would just highlight the main reason why we are switching is because we, as a state, we have, we set a goal, at least I can say this for when I started about 4 years ago, we set a goal to transition the entire PASRR process into an automated technology-driven process. So that's what Telogen is offering the state of Colorado. And based on the communications that we have had so far and what we have seen, with regards to their technology and their expertise and capability and capacity and the human resources that they have and the knowledge base. We feel confident that Telogen is the right vendor to deliver, to help us achieve our objectives as a state with regards to the PASRR program.
The next question might be you too, Obi, if you want to cover that.
We still submit to EQ Health until March 1st. So there are some, and I apologize, Kado, who the person that sent that question, we have the timelines on the memo that was sent out. If you did not receive that memo, please go ahead. My contact information is going to be shared in this training. Send me an email and I'll send you that memo, because the reason I'm saying that is because the memo outlines all the timeline for when providers are required to stop submitting to EQ Health and start sending to another email address. So all that timeline is fully described in the memo. So if you need that information, if anybody needs that information, please reach out to me via my email and I'll send you the memo to give you the detail of that. This is the nursing facilities. I'm expecting a lot of questions, so I hope that answered your question. I'm trying to not take much of the time because I anticipate more questions from this group.
So email Obi if you have questions. We all heard it here. All right.
With regards to, I'm sorry, Jean, with regards to the timeline, I mean, I can answer some questions also. Sorry for that.
We'll clarify.
Confusion.
Don't send all of your PASRR questions to Obi, just on the timeline. All right. Next question is from, I'm going to try to get names here too, from Chorito. If someone helps out in multiple buildings in the same corporation, can they access the same system? This is a great question, and this gets to visibility. So in the Telogen system, we do provide agency visibility. We connect that to the level of at the MPI or at the agency identifier. So if person A, right, Sally, creates a level 1 screen, and Nancy works at the same organization, maybe in a different building, but for the same organization, she logs into Qualitrack, she will also see everything that Susie did, so that it is very much allowed for that kind of visibility. And it works on both ends. So if a hospital is filling out the level 1 and they have identified your nursing home as the likely admission site, then they will indicate your facility within the Qualitrack system. That means your facility can also see and monitor the progress on that level 1, even when it was submitted by the hospital. And we do have a process for if that changes during the course of PASRR evaluations. So from the date the level 1 is submitted all the way through the date the level 2 notice of determination is completed, if the facility that will be admitting the member changes, that can be updated so we can keep visibility flexible for all the people that need it at an organization. So hopefully that answers that question. If not, please reach out and let me know. Also, for those of us who are new to PASRR, would they be able to go in March 1st and submit them as practice until the waiver is over? The system that we're going to go live with on March 1st is our live system. It's not a practice or development or staging system. It is the real system. So not really a good site to do practice work in. But again, we will have lots of demos available through this training. So hopefully that will help. But I wouldn't recommend using the system on March 1st as a demo or practice, because it is the live system with real data that will be kept historically for every member. And Wendy, if that didn't answer your question, please feel free to reach at it. Next one up. Do we need to submit baseline information to the new system for those that have been in our building for some time? Telogen will have access to all previously submitted PASRRs. You will not see that data migrated into our Qualitrack system, but know that Telogen staff will have access to previously submitted PASRRs. What we are asking gets submitted with each level 1. We are asking both hospitals, nursing facilities, and the single entry point community center boards for the same information. If you submit a level 1, history and physical with vitals and H&P from no older than 3 to 6 months, so recent, and then a med list. That documentation gets submitted. If we need anything else, we will let you know. But that's the basic information that gets submitted. And so again, we will have access to all of the previously submitted PASSR work. We just will not see it in the Qualitrack system. Hopefully that answers that question. Next up, what will happen to residents we have already submitted to EQ? So we are definitely going to have a transition period where, and again, Obi mentioned that those timelines are out in a memo for everybody to read through, but there is going to be a transition period where the folks that have submitted to EQ Health are going to get those cases resolved through that system, so that cases in transit don't get switched over, and we can start fresh with new cases on March 1st. So if you've submitted something prior, it will continue through that previous system. Will hospitals go back to providing a PASSR before admission to SNF? That is kind of what we talked about when we covered the 1135 waiver. So that 1135 waiver is a federally issued waiver program that allows states to put an exemption, a 30-day exemption on PASSR level 1 screens, which has meant that the hospitals have not been doing that those have been at the nursing home after 30 days. That is going to continue. The 1135 waiver is not part of this PASSR transition. That's a federal waiver that Colorado requested and was awarded. That will continue, I believe, Obi, through the end of April. Is that correct?
That's correct.
So yeah. Next up, data from EQ Health going to be accessible. Hopefully we've already covered that. Does every authorized official need to complete the packet or just the provider executive? Stephanie, you're up. This is a great question for you to reiterate and cover.
So yeah, the provider executive will start the process, but if there's going to be more than one authorized official for that organization, each one of those will have to complete the rest of the information. So you'll have to fill out your contact information, the organization, all of that kind of stuff will need to be filled out so that we can set up your account in the system. Not every user at your organization needs to be an authorized official. Like I said, you need to have at least one. You can have 2 or 3 if you need to, but then that authorized official or those authorized officials will manage all of those other user accounts at the organization.
Thank you. And then we already covered, will the hospitals go back to doing level 1s? Yes, when the 1135 waiver is lifted. Next question, does the visibility from the single entry point hospitals to SCID facilities include non-triggered PASSR level 1s or just level 2s? Great question. It includes everything. So every level 1 that is submitted for every member admitting to a nursing facility that is licensed to accept Medicaid, 100% of those level 1s will have the same visibility rules as the level 1s that turn into level 2s. So that visibility is at the initial creation stage, and then that follows it through. So that works for 100% of submitted PASSRs. Will we use the same form? Another great question. No, Telogen has its own form in our own system. It's been streamlined and simplified, and we will be doing the in-depth training on that on February 23rd. Again, we will share screenshots. We don't have a PDF copy of the form because it does live in our system. It needs to be filled out in our system. But for reference, we will give you screenshots that show you what it looks like. We will give you those quick reference guides so that you have it. And we will demo it for you in that recorded session on the 23rd. So you will know what to expect. You won't be walking into the system blind on March 1st. We really do believe in giving you enough time to look at those questions and understand the changes that we've made. And again, with the idea, we've moved it to simplicity. I think we've got about 13 yes or no questions. So we've really tried to make it more streamlined and with the goal of efficiency, repeatability, and utility for everybody. So that is definitely a new form. Will the forms for pre-admission and resident review work the same? Yeah, it's the same form. So it's the same level 1 form, regardless of the timing. We have a way in the Qualitrack system to indicate the timing of that level 1. We call it either a prospective, if they have been admitted, if it's prospective to the admission to the nursing facility, or if it's concurrent. Concurrent meaning the member is already at your facility. So it's the same level 1 form, just a different timing for when you build that case in our system. So let me see if I'm getting everything here. Will the form, yep, we already covered that. A provider executive is also an authorized official. Stephanie, this is another great question for you. Can those roles be with the same person?
The authorized official and the person and the executive?
Correct.
Yes. So we do know that there are places and clinics and offices and stuff where that person who's going to be the authorized official and the executive are going to be the same, and that's completely fine. You'll still have to follow the same process. You'll just put your name in for the executive, and then you'll enter your name and email for the authorized official. Then you'll get the email with the link to the rest of the form to fill out so that we have all the details that we need to set up your account. If there is a manager, we prefer that, but if it's both the same, we completely understand that that happens sometimes, and we will set up those just the same as we would any other one.
Perfect. Thank you, Stephanie. And we've already covered the forms. Again, that's the in-depth training on the 23rd. What kind of support can we expect from Telogen, as so many people work to learn the new system after its rollout? Great question. We will have a support line. We'll have an 800 number. We'll have you got all of the emails for the people that are going to be running this implementation. We really want to hear from you. If you have any problems or learning needs that we haven't addressed, questions that we haven't addressed, we want to hear from you. We really love putting out FAQ documentation. So as a result of doing all these trainings, we've gotten some great questions. So putting all of those questions together in a question and answer packet, I think is going to be really helpful for folks. One of the things I know is that if one person says a question, that means at least 5 other people were thinking it. And there's probably also 5 other questions that people haven't felt comfortable to mention yet. So really bring your questions to us in whatever way you feel comfortable. We value your opinion, we value your feedback, and we want it. We want to make this better for folks. So we definitely will be accessible for support after the go live on the 1st. Let me make sure I've got everything up here. This kind of jumped a little bit. Oh, no, that was the end. Okay, what kind of support? So next question from Monique. Thank you for giving me a second to jump ahead here. So let's say you're filling out the online form and you need to go search for some information. Can you save and come back to a form, or is everything required to be done all at once? Stephanie, I know we're going to be covering this next week when we talk about Qualitrack basics and how to submit information to Qualitrack, how to start the review process. But is this something you can touch on quickly now?
Yep. So all of the information we ask for should be available to you. It's like, what's your name? What's your email address? What's your address? One thing that we do ask for is a facility NPI. If you have one, if you don't have one, the Medicaid ID. So that may be the only piece of information that you really need to go search for if you don't have it. But everything else should be available there. I believe that you can save and come back and complete. And I will talk about that again next week, but you should be able to save it and then come back and finish it if you need to find something.
Great. And Monique, if that didn't answer your question, just let us know. Next up, we have, will we be able to print off the new form for the medical record? Of course. So you are required to have a copy of PASRR in the chart for the resident in the nursing facility. So yes, there is a print function for both the level 1, for the level 1 outcome letter. So you can get the level 1 assessment itself. You can get the level 1 outcome letter. You can get the PASRR level 2 evaluation itself, and you can get the level 2 notice of determination letter. So all 4 of those pieces of documentation can be printed so that you can include them in a chart. Again, our system is meant to be online, so we always value people logging in if you've got questions or want to see information. But we also know it's a federal requirement of PASRR that that documentation has to also be available in a medical record. So yes, that is possible. What is your expectation on turnaround times? Again, we got this last time too, and I love these questions. So I'll share for both. So our turnaround time for the level 1 is 6 business hours. So we have 6 business hours to get that level 1 done. And for the cases where it's automated, it'll be instantaneous, which is really nice. And also knowing that you're going to get a level 1 outcome within the 6 business hours of us working that. The level 2, we're really going to push for between 5 and 10 business days. That's what we want to achieve. That's what we want to do and bring to Colorado. It's what we currently do in Montana. 100% of our PASRR level 2s in Montana are done within 5 to 10 business days. So that, and we have several of them that are even quicker than that. So the goal of shooting for 5 to 10 comes from when I mentioned that Telogen really values timeliness, quality, and utility. I meant it. You guys can't operate off of any of the good recommendations we give you, any of the insight that we can offer if you don't get it timely. So that's really important to us to make sure that you do get actionable information that's state approved, that you get a notice of determination letter that's high quality, that has some repeatability, that you can understand where the information is on these forms so that you know how to make use of it. That's really important to us as we move forward. We have some people having sound issues. 5 to 10 business days does exclude holidays. 5 to 10 business days. I see that question that just came through. No sound again. I don't see any other new questions. So we can give some time for that if people want to add some things. I'm not sure, Obi, is there anything you wanted to say as we're looking to wrap up? I do have one more slide to present with to see if anybody else brings in any more questions. But Obi, I'll turn it back over for you for some summary statements.
Nothing. I just want to give time for folks to ask questions. Okay, there's a question here.
Can you share the link to the website in the chat? I cannot find the packet. Let's see. Yeah, if Shelly or Obi, would one of you guys, or Trisha, one of you guys mind sharing the link for the packet? That packet is on, let me get it here. Scroll to that slide. And again, these slides will be published, so you'll be able to copy from the slide. There we go. That's the website right there. This is for the packet. And then I also have a link here for the training notices in case people need it for the next coming weeks. People are going a little blind with the laser pointer there. Here's the training for the other sessions we have for the 16th and the 23rd. All right, so we've got a few more questions here. I want to add those in. Okay, if we do not get to admit on a level 1, if we have to wait 5 to 10 business days. We do not get to admit, oh, no, level 2, that was supposed to be level 2, if we have to wait 5 to 10 business days. So what we will be doing with the hospital staff is working with them to make sure that we're beginning the PASRR process as early as possible so that we can turn around a completed level 2 evaluation in time to do an admission to a nursing facility. Again, this has to be done in real time. This cannot be a barrier, but the level 2 evaluation is an important opportunity for the member. This transition to a nursing home is a vulnerable moment. And we are skilled independent evaluators that have the ability to offer useful information that you, the nursing home, will benefit from. So we will be taking the time to do that, and we will be staying within that 5 to 10 business day window. So this will not take weeks. This will not add time to the process, but it will allow for a uniquely beneficial process at the same time. Next question we have here is, it sounds like a fantastic transition. The EQ suite was a struggle for PASRR, in my opinion. Okay. Where do we get the slides? So we will post everything to this website here. So there is a section here under colorado.gov, Pacific, HCPF, HCPS, pre-admission screening and resident review program. There is a training tab, PASRR training tab, that I believe that's where we're going to post the recordings of these sessions, the slide deck, the transcripts, all that good information for however you like to learn and however you want information. Obi, that is correct? I'm giving good information there. Yep.
Correct.
Okay, good. So that's where you get the slides. The hospital is required to keep the resident in the hospital until the level 2 is approved. Obi, I'll let you speak to that as well.
I'll answer the question in 2 parts. First, while the 1135 waiver is still effective, that should not be an issue. You should be able to discharge from the hospital, admit to the nursing facility without the level 1 or level 2 pre-admission screen. That's while the waiver is still effective. Effective April 22nd, we will return back to normal PASRR requirement. At that time, yes, you cannot admit a client to a Medicaid certified nursing facility without the notice of determination letter issued. So yes, level 2 will need to be approved. If the level 1 was a positive screen and got a referral for level 2 evaluation, the discharge will have to be conditional upon the receipt of the notice of determination letter for that.
Yep. And that also does allow for the provisional admission reason. So there was a previous terminology called categorical determinations, which we will cover in depth on February 23rd. Those categorical determinations were things like convalescent care, exempted hospital discharge, terminally ill patients. So there are exceptions to needing a level 2, even if there are indications of a PASRR condition that arise during the level 1. So those provisional admissions are still going to be allowed. There's several different exceptions that will either go for 14 to 30 days where the member can admit, but then after the expiration of that time frame, a new level 1 will need to be created once that exemption period is over. But those categorical determinations that you're used to, those provisional admission reasons, which again, we will cover in depth on February 23rd, those will all be there as well. And those, they don't need to wait for a level 2 evaluation if it's those reasons. So will this affect admissions? I think we just talked about that. If you have additional questions, please let me know. What if the resident is just coming for a rehab stay? So hopefully that the convalescent approval, yep, I mentioned that is still in effect. That is a federal aspect to PASRR. That is not Colorado state specific. That is federally there, that there are these exemptions to needing a PASRR level 2, even if there's suspicion of known PASRR condition. It'll be within those categories. And we can cover that on the 23rd. That has not changed. Will the new software be able to differentiate major depressive disorder diagnoses? Yes. Our system is built with the DSM-5 codes. So all the modifiers, all the specifiers is detailed with the code you want to get. Our system can distinguish between those. Okay, and our level 1 screeners are very skilled in knowing that too, because I think what that question from JC4771 is referring to is that nuance in the PASRR definition of mental illness. And we'll cover this on the 23rd as well, but just because you have a mental health diagnosis does not mean you meet a PASRR level condition. There has to be a level of severity. There has to be a level of disability. So there are some criteria to that our staff is very skilled in being able to know that nuance and help guide through that nuance. So to clarify, the hospital will need to hold patients 5 to 10 days. So yep, so hopefully we covered that. You don't want patients staying in the hospital for a prolonged period. We absolutely do not want that. So we want PASRR to be as streamlined as possible. How is the communication between the facility and Telogen reviewers?
Jen, can I add something real quick to that, please?
Yes, go ahead.
So Jen was asking about, so I just wanted to add, Jen, that we are going to have the option to use the exempted hospital discharge. That's a great feature that is going to come within the provisional admission. So if someone is discharging from the hospital, for rehabilitative reasons into the nursing facility, we should be able to have that expedited process for those purposes with the physician's signature. So those will be some of the, new things that we're getting from Telogen that we've not had before Telogen.
Yeah, and that automation is nice. So when our system notices those flags, they'll get an automatic real-time notification that they have a provisional admission and their PASRR process is done and they can move on with the admission. So that will come to them in real time when those conditions are met. So yeah, that is an exciting feature. How is the communication between the facility and Telogen reviewers handled? Will they call us if there are questions? So through the QualiTrack portal, which we can cover in depth next week when we talk about the QualiTrack portal, we have a system of automatic notifications and tasks, and we're going to be leveraging an aspect of our system called the request for additional information. So if when our reviewers are manually looking at the case that's been submitted and we determine that more clinical information is necessary to either determine if a level 2 is required or to complete the level 2, we will send you communication through our system and you will be able to drag and drop and upload additional documentation at that time. So that's a really, again, nice feature of the system that we're going to leverage for PASRR. And then I think the last comment just says, How will there be a different form for the post-admission updates? And as I mentioned before, it's the same form. The only thing that's going to be different about the level 1 is that timing. The prospective, when you create the case, means they have not admitted to the nursing home yet. This is a prospective level 1, or it'll be a concurrent when you create the request. Concurrent meaning the member is already in the nursing home facility. Other than that, the form is exactly the same, but we do track them differently from a data standpoint. Can software detect incomplete forms? Yes, we have required fields, so you will not be able to move forward without required fields. Does the system alert us outside of the portal, or do we have to log in and monitor the portal? The email address that's connected with the submitter will get automatic notifications via whatever email address is connected with the account. When you guys create your account, so you have to add an email address. At the level of visibility, the entire agency can see the case, but it's the individual that originally submitted that will get the notification. We can't send automatic notifications to every email associated with an agency because it may or may not be relevant. So we will cover that more as well next week when we talk about the Qualitrack program and the details of that system. Okay. And then I think we've got, that's the last question I see in the chat. Hopefully I haven't missed any. We do have about 9 minutes to go. So I'm going to switch to our last slide, and then please feel free, if there's other burning questions, continue to submit them while I go through our last slide, which is here about putting it all together. So in summary, I just want to leave folks with a few key points. PASRR is a person-centered process to provide an objective clinical assessment for folks that could potentially benefit from additional services at the nursing home level of care, specific to their PASRR condition. Nursing home transitions are vulnerable times for individuals and their families, and we want to be mindful of that in how we approach PASRR in Colorado. Now, PASRR is a federal requirement that's been around for over 3 decades and continues to maintain relevance and provide benefit for individuals. There's new webinars that come out every month from PTAC. There's the new notice of proposed rulemaking that just came out in 2020 to update the rule. So there's a lot of utility here. PASRR is a clinical opportunity, not a paperwork compliance requirement. I want to try to make that as clear for folks as I can too. We really do believe that there's a great deal of clinical utility that comes from having an objective, outside eye, mindfully review and assess the individual when appropriate. And if not warranted, then there's a quick turnaround in closing out the PASRR process. We don't want to add that barrier if it's not a necessary step for the member's care. Turnaround times and utility of output documentation matter, and it's key to the success of a PASRR program. You need to know when you get a level 2 completed from us where the relevant information is, how to use that, how to make that actionable, how to use that as a benefit for the member. So it shouldn't take you weeks to get actionable information as you begin working with new residents while you're waiting for feedback around appropriateness of the nursing facility specific to a PASRR condition. The documentation you receive post level 2 should add value and be consistent. By leveraging our system automation and having a unified team with telehealth capabilities, we feel confident we can improve the PASRR process for all stakeholders. And lastly, Telogen is committed to hearing directly from all stakeholders and evolving the process as needed, based directly on your feedback, so that we can maintain the best efficacy and satisfaction for all involved. That is extremely important to us. Last question that just came in while I was reading that. If we need to update a level 2 PASRR and it's past March 1st, the person reviewing it will have access to what was submitted. Yes. So the previous submissions for PASRR and all the previous documentation relating to PASRR from the EQ system will be available to Telogen employees. We will have access to it. It will not be migrated into Qualitrack, but we will have access to it. So if we're updating information, if there's a status change for a resident that just had a recent psych admit, or if something else changes, behavioral disturbances, if anything about the member's presentation changes, even if you had your level 2 in January, we will be able to access that when we look to do a status change or resident review. So hopefully that helps. Yes, information prior to 2019. I can turn that one over to Obi about how Telogen's going to get access to information prior to 2019. And then that might be one of the last questions we have.
Sure, yeah. So if you need information prior to 2019, you will need to send me an email so we can get into our archives to be able to pull up that information. Those will not be among the data that we'll be sharing with Telogen.
So again, just go to Obi. Okay, perfect. This has been fun, everybody. We did it. We went through the whole slide deck. We got ourselves introduced. You saw faces, you know names, you have our contact information. We're going to be talking to you again. Next week, we'll be here before we know it. If you have any other information or questions, contact us. Let us know. We're here for you. Otherwise, we will see you next week. And please spread the word. And we're going to try to keep it to the 300 or under. So if you have multiple people at your organization, spread the word that you guys can have maybe only 1 or 2 people from your organization actually logged in to view it live. And then you can all maybe sit around at a staff meeting and share the video and have a good laugh at us as presenters. We are human, so we have human moments, but we really have appreciated your time today. So in my very last closing statement, what I want to leave you with is 2 things. I want to leave you with thinking about your takeaway. We've spent an hour together today, 56 minutes to be exact from my timer. In that hour, what did you learn? What was a unique piece of information that maybe you didn't already know that you'll be able to take with you later today, tomorrow? It'll noodle around in your head. And then what, if anything, are you going to do differently as a result of this information? Are you going to talk about PASRR differently? Are you going to talk to your coworkers differently? Are you going to reach out to other people? But really, how has this hour changed you and what have you gotten out of it? I think those are really important things to end with when we're doing a training like this. So thank you all very much. And we will see you next week.
Thanks, so.
Yeah. Stop the share and then I will end the meeting. Okay. Bye, everybody.